Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
I want to welcome everyone to a special edition of Heart Health. Excuse me. I'm sneezing. Well, guess what we're going to talk about tonight? Yes, we're going to talk about allergies tonight. We have Dr. Lee Perry with us, and I hope you're not sneezing out there. We want you to pick up your phone right now because all the phone lines are empty. Our call center is ready to take your call, 855-644-3278. And at Heart of Health Live, unlike other health programs, we have real live doctors that see patients every day. We're not trying to sell you a gimmick or a fad. We just want to meet your need and give you good health information. And tonight, our topic is about allergies. Our director, Michael Bell, gave me some statistics that I want to share with you. Did you know that allergy is characterized by an overreaction of the human immune system to a foreign substance called an allergen? And sometimes those allergens are eaten, sometimes they hit our skin, sometimes they come from food and drugs. Right now, it's estimated that 50 million Americans and people all around the world suffer from allergies, and it's the 5th leading cause of chronic disease. So either you have an allergy or someone in your house might have an allergy. This is a program that's going to be very useful for you. It also is one type of condition that's almost overlooked. Other conditions mimic it. I know every year I think I'm having a cold. It's really an allergy. The antibiotics don't help me, but when I start an inhaler, it makes me feel a lot better. And I bet you're the same way too. 17 million outpatient office visits are because of allergies. So that's a lot of visits, and the annual cost of allergies is about $14.5 billion. So Dr. Perry's not going to charge you anything for his information. Give us a call. You're watching Heart of Health Live. Our number, 855-644-3278. We're going to be right back after this short break.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Would you like to experience better physical and mental health? Then consider volunteering in your community. Studies have shown that youth who give of their time to help others perform better in school, have greater self-confidence, and are more likely to become leaders in society than those who do not. And amongst adults, those who volunteer experience better physical and mental health, lower rates of disability while maintaining their autonomy as they age. And amazingly, these benefits persisted even after taking into account baseline limitations, socioeconomic status, health status, employment, exercise, smoking, and marital status. When we volunteer to help others, we activate the brain's love circuits, which calm the brain's fear circuits, reducing inflammation, thereby reducing physical and mental illness. To be smart requires a healthy brain, so be smart, live to give.
To learn more about mental health, visit comeandreason.com.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's one every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
I want to show you my new book that I've just written. It's called Medicines That Kill. This book's available. In fact, we're encouraging people to go to our Facebook page. And if you're one of our Facebook, either like us on Facebook or join us on Facebook. That's Heartwise Ministries. We'd be happy to send one of these. Our communications director, Nick Evanson, is going to give a drawing for this at the end of the program, and one of you can get this book, and this book lets us know that medicines are not to be taken lightly. There's a place for medicines, but we have to be very careful. And you look at all the overdoses and inappropriate uses. This book goes through all this. It might be a good resource for you. Dr. Perry, welcome.
Thank you.
I know that in the air there's been lots of pollen.
Yes, yes.
Why is it so bad?
Well, in the spring, it depends on the time of the year. So in the spring, it's tree pollen, and this is just the time of year the community or the environment just allows for trees to pollinate during a certain time of the year. And for tree pollen, it's always in the spring. In the summer, it'll give way to grass pollen, and in the fall, it's ragweed or other weed pollens. And it's just a matter of where you live in the country. In the southeast right now, everywhere is covered with yellow. There's yellow powder, yellow dust floating around. You can see it on the cars. You can see it on the ground. And that's all mostly tree pollen. And it causes allergic rhinitis or hay fever. The primary symptoms of allergic rhinitis are runny nose, sneeze, itchy watery eyes, and congestion of the nose. And we see that on a daily basis here, especially in Chattanooga. But all throughout the southeast and wherever you are, there's pollen for sure.
So what are some other things that people might have allergies to?
We can see allergies on a daily basis. I see patients for allergies to pollen. Of course, we just talked about that. Dust mites, cockroaches, pet danders, molds are very common. And of course, we also test many patients for food allergies. Okay. And you talked about your book and medications. We can test for some medication allergies. Not many are to have valid tests for them, but that's another thing that we see a lot of.
Yeah. You hear a lot about peanut allergies.
Yes, absolutely. Peanut allergies really taken off. My oldest son is 10, just turned 10. He has peanut allergies. I'd never heard of that much peanut allergy when he first was diagnosed. I was a med student, and he had a peanut butter sandwich, I think, and developed some hives and vomiting within 15 or 20 minutes. And since that time, I've been noticing, and as an allergist, I see a lot of peanut allergy. The frequency of food allergies in general, and especially to peanut, has really been skyrocketing. Several years ago, a couple of decades ago, most people didn't know anybody with peanut allergy, but now if you walk in my shoes on a day-to-day basis, I see patients every day with peanut allergy and tree nut allergy. It's really taken off over the past few years.
Now, you mentioned the word allergies. What's actually happening in the body that makes you have all these symptoms?
Good question. So allergies are, we all have antibodies in our body that typically are designed to help fight infection.
Okay.
So if you go to a third world country, their immunoglobulin E, which is what causes allergies in our country. Immunoglobulin E is a protein that fights parasitic infections in third world countries. And here in the United States, we don't have parasites to fight. So our IgE, like you said, is our immune system fighting against a harmless protein like pollen or mold or cat dander or dog dander or food. And when your immune system fights against that harmless protein, it produces symptoms. Okay. Whether it's in the nose or in the eyes, in the lungs, on the skin, in the gut with vomiting or diarrhea. Allergies can cause all of those symptoms.
Now, would you say that some people, occasionally someone will come to me and I can't find anything wrong with them. And I said, well, you got to think about the body attacking, especially the GI symptoms. I said, well, maybe you're allergic to something.
It's possible, yeah. Food allergies can kind of mimic a lot of different things, and if you've gone through a checklist of, well, it's not this, it's not that, it's not this, it's not that, it's always a good idea to at least consider allergy, especially if you're having, in the case of food allergy, if you're having symptoms within 15 minutes to 2 hours of exposure to a food, that's often a food allergy that we can diagnose.
Now, you brought some neat stuff. Show us what
Yes.
you brought us in here.
Okay, so whenever we diagnose allergy, a lot of people ask, how do you diagnose allergy? How do you determine if somebody has allergy? The best way to do it is first to sit down like we're doing now and just kind of talk about the history.
Right.
Try to determine what your symptoms are and what kind of pattern you experience those symptoms in. Is it always in the spring or always in the fall or always after a particular type of food? And that helps us determine what we should test you to. When we do skin testing, we use these little plastic picks. They're called derma picks. They have really small pointed edges to them at the end. And when we dip the derma pick into a liquid extract of pollen or whatever the allergen is, we can just scratch the skin with that pick, and it produces, after 15 minutes, if you're allergic to whatever that is, it'll produce a wheal and flare, which is like a mosquito bite with a little bit of area of redness around it. And the larger the area of redness, the more potentially allergic you are to that substance.
Okay.
So that's how we do allergy testing, and we can find out the results within 15 or 20 minutes, which is kind of cool.
So you have a bevy of things that people are allergic to, right?
Correct. We have a whole tray of basically tree pollens and grass pollens and weed pollens and molds, and we have one of these per allergen, so that when my nurse comes in with a tray, she's going to take that and just kind of scratch each one, and each one has a individual test. So every time she scratches, it's an individual test.
Wow.
With
So
each
that
individual
doesn't
pick.
hurt, does it?
No, these don't hurt. These, if anything, they itch.
Okay.
And a lot of the kids kind of get nervous when we come in with a tray like this, but these really don't hurt at all. If they're positive, they itch a lot, but they're not going to cause any pain.
Okay. Well, what else you got over there?
These are also two different types of epinephrine. So one of the things we use to treat allergy, especially if you have a life-threatening allergy to foods, especially peanuts, tree nuts, or shellfish are the most common, or life-threatening allergy to insect stings. These are two types of epinephrine. Epinephrine is the medication we use in the instance of an allergic reaction to one of those things. So if you experience anaphylaxis, for instance, to peanut, we would prescribe one of these. These are the two types that are on the market. Just depends on the patient. I usually let the patient choose. This is the EpiPen. It's been around longer, and it's basically, this is a cap that you take off of the tip of the pen, and you can inject it into the lateral thigh. And I would never do this in the arm. I'm just doing that for demonstration purposes. But you administer it in the lateral thigh, and it administers the medicine into the thigh. And this is the newest one, the newest version of epinephrine that just came out is called the AviQ, and it's shaped a little bit. The reason I like this one for certain people is like in a teenage boy, for instance. A teenage boy is not going to carry this around in his pocket. It's just too big. It's too cumbersome. And teenagers need to carry their epinephrine with them if they're allergic to honeybee stings or if they're allergic to peanuts. They should have their epinephrine at all times. So for that patient, this epinephrine administrator might be a little bit better because it's shaped so neatly and it can be carried in the pocket a lot easier.
Now, you showed me, it makes some noises too. That's pretty cool.
It does. So this is a trainer. It does talk to you when you take the...
This trainer contains no...
This one doesn't have any medicine, but when you take the trainer out of its sheath, it'll give you step-by-step directions on how to use it. So that's pretty cool. Excuse me. You pull off the red safety guard and you inject it into the lateral thigh. So it's kind of failure-proof. It tells you exactly what to do and where to inject it. Both are very easy to use. It's just a matter of which one you'd rather carry around, and also which one's covered by your insurance.
You know, and that could save your life if you accidentally get a peanut or actually get stung by a bee or something that you're allergic to.
Yeah, that's the whole point. If a patient has a history of life-threatening reactions to any of those things, it's essential that they carry this with them. You never know when you might get stung. You never know when you might be at a restaurant. You're not going to intentionally eat peanuts or tree nuts, hopefully. I have patients who have done that just to check and see if their allergy was still there, which I don't recommend. But accidental exposures are very common. And in an accidental exposure, you want to be prepared to be able to treat the symptoms.
You know, Lee, I really like Thai food. And Thai food has lots of peanuts.
It does.
So I'm hoping someone that owns a Thai restaurant is owning this. Maybe you might want to invest in one of these just to keep under the counter, just in case. Well, we're talking with Dr. Lee Perry. He's an allergist that sees patients every day, including children. If you want to give us our call, our number is 855-644-3278. You can join us on Facebook or our website, heartwiseministries.org. Don't forget about our book, Medicines That Kill. You can sign up for the drawing. And Dorothy, we haven't forgotten you. We're going to be right back after this break. So stay with us, Dorothy. We're going to answer your question next.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that HeartWise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support HeartWise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Break away from the noise of life and spend time communing with God with the Celebration Cup 30-day devotional set. For just $18.97, you'll receive 30 pre-filled communion cups, a 30-day scripture calendar, along with a daily devotional. Celebrate communion in the privacy of your home or office. Are you ready to put the powerful blood to work in your life? Call 866-367-2877. That's 866-367-2877.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Our number, and you are watching us live, is 855-644-3278. Dr. Perry, Dorothy had to go, so she's not on with us, but we did have a question that comes in, and this question, they want to know if pollens can make you sleepy, and this person says, I feel tired and I feel like I have the flu all the time. Could that be a symptom of allergies?
Yeah, definitely fatigue is a common symptom of allergy, because when you have severe inflammation in the nose and sinuses and sometimes itchy, watery eyes, those kind of symptoms can really affect your ability to sleep.
Right.
When you have nasal congestion and things like that. So my guess is that if your symptoms are occurring on a seasonal pattern, especially in the spring, for instance, or in the fall, then certainly I would look at pollen as a potential source. Now I would also ask you, do you have other symptoms of allergy? You know, usually if you have allergy to pollen, you're going to have some sneezing or some runny nose or itchy, watery eyes as well. At least some of that.
That's a good question. Okay.
Yeah.
Julia, you're on with Dr. Lee Perry. Go ahead with your question, Julia.
Yes. Hi. I'd like to find out, my granddaughter, she's 7 years old, and she's always got like a stuffy nose, runny nose, always like stuffy. I don't know what's going on. I mean, I don't have her all the time. When we have her, she seems like her nose just runs and like really a lot. I mean, I don't know. I don't understand. I don't know. What can I do?
That's a great question. So I would start with talking to your pediatrician, her pediatrician about it. That's usually the first step. I'm not sure where you guys are, but certainly here in Chattanooga, we have a great relationship with the pediatricians, and oftentimes we'll get referrals of patients just like you described, where your granddaughter has lots of congestion and runny nose and those types of symptoms. That seems to always be the case. A lot of times we'll get patients like that and at least do allergy testing on those patients. Yeah. That's where I would start. I would start with doing some good allergy testing to try to figure out if anything in our environment could be triggering those symptoms. A lot of times we'll test 7-year-olds and not find any allergy. In that case, it may be several things. One, it could be recurrent infection that you're getting at school, recurrent colds. Sometimes you'll ask a parent about that, and if you have a pattern where the symptoms seem to get really bad, and then for a couple of weeks, and they start slowly getting better, and then a couple of weeks later they'll come back again. It's kind of up and down. That might be that the little one is getting recurrent colds or bugs at school, picking up things at school are causing infectious symptoms. And then the third thing that can do that is changes in environment, changes in barometric pressure and temperature. We have lots of abrupt changes in temperature where I live, and changes in weather. And those symptoms are called vasomotor rhinitis, where you're not really allergic to anything, but you might be really sensitive to strong odors, scented candles and potpourri, cigarette smoke. And those are things that can also trigger nasal congestion and runny nose. So I would start with allergy testing, and then if that's negative, I would work my way through those other things.
Okay. Well, I know she does eat a lot of cheeses. You know, and she's not, like I said, the mother, she don't believe in a lot of health. You know?
Right.
And I do, but, you know, I don't know if it's something to do with the kind of cheese.
Yeah, I mean, that's a good question. It's probably not a food allergy. If your only symptom is runny nose and congestion, it's probably not a food allergy. It might be that she's getting too much and can't digest it well. There's something called lactose intolerance. But lactose intolerance usually causes GI symptoms like bloating and gas. Occasionally you'll have a patient that attributes nasal congestion to too much milk or too much dairy, but I don't think doesn't sound like that's what's going on with your granddaughter.
Okay, yeah, okay. Whatever I could do, whatever I could suggest to the parents.
Yeah,
and then whatever. But they said that the doctor said that to my daughter-in-law, they said there's nothing wrong. It's a normal thing.
And she might be right. I think it warrants sitting down with her pediatrician and maybe an allergist to make sure. But the parents might be right. She might just be a normal child having some runny nose and congestion. But I think you need to do a little bit more investigating first.
Okay, doctor. Thank you so much.
You're welcome.
You have a good night. God bless you.
Thank you.
Too.
You know, Julia's doing what every good grandparent should do.
Yeah, she's right.
They're concerned about their children.
Absolutely.
You know, in your office every day, what would you say I know you treat children, but what's the leading cause of when people come in to you? What do you usually find out's wrong? Is it just a pure allergy, or is it maybe they don't even have an allergy, have something else?
I think it's most of the patients that come to me are allergic. They've been pre-selected by our primary care physician usually, or they kind of identify their allergies being seasonal and they come in and get tested. We see a lot of asthma. I mean, there's over 20 million Americans with asthma right now. And so one of the main things we see on a day-to-day basis is poorly controlled asthma. And then also seasonal allergies, food allergies.
Mm-hmm.
We see a lot of eczema and hives and urticarial rashes, and then also things like medication allergy and stinging insect allergy too. But I think the vast majority of patients that come in our office do have an allergy to something. We do find occasionally that patients will come in and all these tests that I talked about will be normal, and they still have the same symptoms of somebody with bad allergies. And then we have to those are the frustrating patients for me and for them, because somebody with severe pollen allergy is easy to treat. That's very simple. It's straightforward. Somebody that has similar symptoms, horrible congestion and runny nose and drainage without the allergy, are a little bit trickier to treat.
Okay, well, Joan, you're on with Dr. Perry. Joan's calling from Maryland. Go ahead, Joan. Joan, you there? It's your turn. Joan going once. Joan, do you hear us? Okay, well, you know, we're waiting to talk to Joan, and if Joan comes back, we'll grab her. I'm going to try one more time. Joan, do you hear us?
Yes.
Yes, go ahead.
My question is for Dr. Perry.
Yes, go ahead, Joan.
Yes, yes, I can hear you.
Go ahead
Thank you.
Go ahead with your question.
Yes, my question for Dr. Perry. Yes, I hear you.
She's listening to the TV.
Yeah, Joan, turn off the TV. You got to turn off the TV.
All right, I will.
Okay, just listen. Just do the phone.
Yes.
Go ahead.
Dr. Perry, good afternoon. Are you hearing me?
Yes, ma'am. We hear you fine.
All right. I've had allergies for a long time. I can't even count the years. So I got tested, and the doctor said I'm allergic to dust. Even when I go to the store, I have to put on a mask. But the thing that, and it's all here too, the thing that bothers me most is when I have a bad attack, I get chills all over, and it happens often. So I'm always feeling cold. I don't know what that may be. I know it's an infection, but I don't know how to treat that. I got antibiotics and all that stuff, but I really don't know how to treat that.
Good question.
Can you help me?
Yeah, sure. Well, Joan, that's tough because most times allergies won't cause fever and chills. So if you're having lots of fever and chills, it's probably not an allergy. And I would look at other potential causes, whether it be an infection or some other thing. We're talking about the difference between an infection and allergy earlier. Allergies never cause fever. Okay, so if you have 100-degree fever, 101-degree fever, you can almost assure
It's not really hot. It's just
Okay.
cold chills.
Cold chills. Yeah. That's not really a common symptom of allergy either. I would probably sit down with your primary doctor and talk about that a little bit, try to explore that a little bit more, because chills aren't really one of the most common signs or symptoms of allergies that I see daily.
Yeah, right. So I thank you.
Okay,
You're very
thanks for
welcome.
calling, Joan. Appreciate it. You know, when I see chills, I always think infection first. You know,
Sure.
chills, rigors, and that. So that you know, the fact that it comes at funny times, that's what makes it a lot harder.
Right.
So
That's a good
now
point.
a lot of people don't like to go to primary care doctors, but that's where you usually start in your evaluation. Give us a call, 855-644-3278. Dr. Perry will be on. He can answer your question. Creasy is next from Tennessee. We'll be right back.
The Heart of Health Live will return in just a moment.
Could It Be This Simple changed my life. What an amazing and solid yet fulfilling and liberating message Dr. Jennings provides. I loved it.
It is liberating. It frees your mind from all your mental turmoil and teaches you what is really going on.
This book is amazing and makes so much sense. It shows God as a God of love rather than an arbitrary, exacting God.
I am so grateful that a friend suggested I read Could It Be This Simple? It has helped me fine-tune my thinking.
This book not only helps the mind to heal, but helps to liberate the emotions by bringing them into balance. You will be captivated with the case studies liberally sprinkled throughout this small, easy-to-read book. I dare you to read it.
Get your copy of Could It Be This Simple? A biblical model for healing the mind at Amazon.com or wherever books are sold.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. Hi, I'm Dr. James Marcum, Speaker, Director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Our number is 855-644-3278, and we're so thankful that Dr. Lee Perry has volunteered to give his time. He's not getting money for this. He came after work. He's got a big family at home that's waiting for him, and we want to thank them for letting us borrow Dad for an hour to answer your questions and help serve. Did you know that when we serve each other, it helps change our body's chemistry? a part of the brain called the anterior cingulate grows, and it helps your brain get bigger. So service is actually a treatment for the world. So get out there and do some service. So I'd like to say, Dr. Perry, by being here, we're making your brain better at least.
Oh, that's great. That's awesome.
Creasy, you're on with Dr. Perry. I probably didn't say your name right, Creasy, but you're on. Make sure your TV's off. What's your question or concern?
Hi, Dr. Perry and Dr. Marcum,
Hey.
and you
Hi.
pronounced my name right.
Great.
But anyway, I have allergies. I have just been diagnosed with allergies.
Okay.
And I have had one allergy shot, and I have been so sick, not from the allergy shot. I want to state that ain't it. But what I'm trying to say is, sir, that I have had nothing but infections the last couple of months and have not been able to take an allergy shot. And now I've been diagnosed with rheumatoid arthritis, and I know that the allergies are caused from immune problems, and rheumatoid arthritis is caused by immune problems. Is there any connection to there, do you think?
Good question. Yeah. You know, there's some connection in some patients, but not everybody who has arthritis has allergies. Not everybody that has allergies has arthritis. Both are similar in their basic mechanism, which is your immune system overreacting. Your immune system is working too well. So there are some similarities, but they're also very different. For instance, there's a field of medicine called rheumatology. That's all they do is deal with overactive immune systems or autoimmune disease. And then I'm an allergist, so I'm dealing with kind of a different autoimmune disease, or not an autoimmune disease, but...
I'm sorry.
That's okay. No, that's a good question. No, you're right. So in allergy, our immune systems are not acting against ourselves, but it's acting against a harmless protein from the environment. Both cases are the immune system being too active, overactive. So you raise a great point. I'm not sure why you're having so many infections recently. That's a good question. It sounds like you're on allergy shots. How long have you been on allergy shots?
I only just had one, and that was only about a month and a half ago. I have not been able to, because as soon as I get off an antibiotic, bam, I'm back on it.
Right. So it sounds like you're having more.
Antibiotics in 2 months.
Oh wow, that's a lot of antibiotics, and I'd be concerned about that. I would sit down. If you were in my office, the first thing we would do is talk about what kind of infections you've had. Sometimes it requires using the right antibiotic for the right infection.
Right.
Certain antibiotics are
Sinus and upper respiratory.
yes. So certain antibiotics are really good for sinus infections, and some aren't very good. A lot of doctors use Z-Paks and things like that for sinus infections, and sometimes those aren't the right antibiotics. So that's the first thing we would do. Is the right antibiotic being used and for long enough? Also, we need to question the diagnosis. Is it really an infection? Is it an allergy? And sometimes I'll do some imaging in a patient like this who's had 3 or 4 courses of antibiotics over a few weeks. We might do a sinus CAT scan or a CT scan of the sinuses to figure out if there's really an infection there. And if there is, we need to try to really definitively treat it with the right antibiotic. If it's not an infection, then we need to more aggressively treat the allergy. Allergy shots are a great way to do that.
Mm-hmm. Yeah, see, my family doctor is helping me with that. He sent me for a CT scan of the sinuses.
Great.
And he's also sending me to a sinus doctor.
Good.
That sounds like a great plan.
Okay, I was just wanting to know if the similarities with the rheumatoid and everything being, immune deficiency problems or whatever you call it. I thought they had connection. Thank you for answering my questions, and you have a good night.
You're welcome.
Thank you, Creasy. That was a great question. Sometimes these issues are very complicated, and it takes some time to sort through them. Yvonne, you're on with Dr. Perry. Go ahead, Yvonne.
Hello, Dr. Perry and Dr. Marcum. This is me, Yvonne, calling from Georgia, and I am 29, and it's been about on and off for more than 10 years of every sort of allergy I'm suffering from this year, January to April. I've had 7 courses of different antibiotics. From the gritty eyes, the itchy, scratchy throat, they did an allergy test, and everything came up from pet dander to dust mites to grass to horsehair, and I am so miserable. I don't know what else to do at this point.
Wow. That's kind of you're kind of my bread and butter patient, honestly. You're what I see. I've seen 4 of you today, okay? So what we do is there's 3 things we can do for allergies. There's only 3 things. Number 1, try to avoid your allergen, okay? So that things like dust mites and pet danders, you can avoid those to some degree. Pet danders, you can either put the pets outside of the house, at least put them outside of your bedroom if you're allergic to them, keep them out of your bed, because that's where you're spending hopefully 8 or 9 hours a day or a night. So we want to avoid the pet danders. Number 2, we can avoid dust mites. Dust mites are little tiny microscopic insects that live in your sheets and pillows and box springs and mattress. And we recommend washing your sheets on really hot water once a week. You can also buy dust mite covers for your mattress and pillow that have zippers on them. You can get them at Walmart or Target or online. And they should say dust mite or allergy covers. And you keep those on your mattress and pillow at all times. So those are the things we can do to avoid our allergens. Now, unfortunately, in Georgia and Tennessee and everywhere right now, pollen's flying everywhere. There's nothing you can do to avoid pollen. It's really hard to avoid mold. So the next thing we can do are the allergy medications. Okay, after avoidance, allergy medications. You've probably been on a few of them, I'm guessing. Over-the-counter antihistamines like Zyrtec and Allegra are very effective at treating runny nose and sneeze and itchy, watery eyes. And then we also have several different nose sprays that we can use. I would avoid the over-the-counter nose sprays. They're not healthy. They're not good for you. But the prescription nose sprays, if the right one and the right patient, can be very safe and very effective in treating allergies. And there's also a few other medicines we can use, but those are the main medicines we use. And third, in a patient like you who has allergies to all this pollen and pet dander, immunotherapy or allergy shots is by far the best treatment because, number 1, it's all natural. Number 2, it's a cure. So instead of treating the symptoms of your disease, we're treating the problem, which is that you're allergic. All the medicines are doing are just treating symptoms like runny nose and sneeze. They're not doing anything for the problem. They're just kind of putting a mask over it or covering it up. So allergy shots are designed to hopefully cure the allergies and decrease your need for medications. So that's what I would recommend. I would recommend doing probably a little bit of all 3 of those things until you get to feeling better.
Okay, Yvonne.
Wonderful. Well, now, just with the allergy shots, how often should you do it? Would it be like once every 3 months, or is it a weekly thing?
Good. So there's 2 phases to allergy shots. There's a build-up phase and then a maintenance phase. During the build-up part, we start you with a really tiny dose, and we slowly increase the dose of allergen over time until you reach what's called your maintenance dose. And so during the build-up, you're getting a shot about once a week. Some patients come twice a week if that's convenient for you, but at least once a week. That takes a few months, and once you get to your top dose, then you go every 2 weeks, and you stay on that every 2 weeks for usually a few years. Okay, so it does take a lot of time. It's a time-consuming process, but in general, if you've got somebody who's severely affected by their allergies, it's worth that extra time to treat it definitively or to cure it.
Well, I do thank you so much, doctors, for all your information. You guys are doing a wonderful work, and God bless.
Thank you, Yvonne. Wow, that was a great question.
Very good.
You know, if one person has that question, Dr. Perry, lots of people have that question.
Right.
So, and Dr. Perry worked for the Chattanooga Allergy Clinic. We're going to pause for a second, let Dr. Perry catch his breath. And Angela, we're going to come back to you after we give Dr. Perry a break. So stay with us.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program, but we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the tree of life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
The Celebration Cup is the sanitary and reverent way to celebrate communion, whether in personal devotion or with your church or other ministry group. Thousands of churches use the Celebration Cup regularly in their services, and it is perfect for ministries on the mission field, retirement centers, and other outreach ministries. You can order 100 Celebration Cups for only $25.97. Call 866-367-2877 or go to celebrationcups.com. When you call, ask about our free sample pack. Call now.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Angela, thank you for waiting for us. And Angela, you're on with Dr. Perry. Go ahead with your question or comment, Angela.
I was just curious if someone was felt kind of chilled, like if anyone who touched them, they felt really cold, but they themselves felt overheated, like really, really warm, maybe like feverish even, what that would have to do with.
So how often is that happening?
Most of last week.
Okay. It's hard to say without a little bit more. Are you having any other associated symptoms, or is just the chills and feeling hot?
I wouldn't know if anything else was associated.
Oh, it wasn't you. It was someone else.
It was me, but I wouldn't know if anything else was connected with it.
Were you having any other symptoms at all other than the chills?
No.
No. Okay. Well, it doesn't sound like an allergy, really, to be honest with you, based on the symptoms you've described, the chills and feeling flushed and things like that. I would pursue other things. Yeah, infection. Viral illness, infection, obviously, definitely. Especially if you have a low-grade fever. Low-grade fevers can cause chills, and then when the fever resolves, often you feel hot or flushed. So that might be what's going on, or what was going on with you.
And Angela, one thing I've noticed is that if it's something serious, it keeps coming back, and it keeps bothering you. If it's gone away, great.
That's a great point.
Yeah, but if it keeps coming on, then that's when you need to probably go see your doctor and get him to look under the hood and check your fever and check your blood counts, all those things.
Yeah.
Thank you.
Thank you, Angela. Okay. Sarah, you're on with Dr. Perry from not too far down the road in Ringgold. Sarah, go ahead. Sarah.
Hello?
Go ahead, Sarah. You're on with Dr. Perry.
Hello, Dr. Perry.
Hey, Sarah.
I have a breaking out all over my body, and I've had it for 2.5 years. I have been to 3 skin specialists and a bladder kidney specialist. Nobody can find out what it is, and we've eliminated my medicine one at a time, and I still can't. And it's just all the time, the only relief I get is vinegar and water mixed together and just spray it on me, and that only lasts temporary. And I just wondered if you would know something I could try.
That's a great question. It's really hard to diagnose a rash without seeing it, but hearing that kind of rash, it sounds like you've had a really thorough evaluation. You've seen dermatologists and other specialists, and the rash has continued despite that. I would ask one quick question. Have you had a biopsy of the rash?
specialist and the rash has continued?
Yes, I've had, and that's where they scrape the skin.
Well, a biopsy is not really a scraping of the skin. It's where they take a little needle and they punch a little hole out of your skin. And they look at it under the microscope. And sometimes if you've had that, okay. Well, that's the first step. If I see a rash, somebody that's had a rash for several years and has seen several specialists already, it's sometimes really difficult to come to a diagnosis. It may be an urticarial rash, which is another word for hives. Mm-hmm. Hives look like little mosquito bites that itch real bad, and they kind of come and go. They move around. They're migratory. And it may also be some sort of dermatitis. A real common form of dermatitis that I see is contact dermatitis, and it's a rash that comes that starts due to something that's coming in contact with your skin, whether it be a soap or a detergent or a moisturizer or a cosmetic or your clothing. And we can do testing for that. It's called patch testing that we can do. I'm not sure if you've ever been patch tested at one of the dermatologist's office. They do some of that too. Certainly to make a more informed, have a more informed opinion, I'd have to see the rash first, but that's where I would start, that kind of process of trying to diagnose the rash.
Okay. Well, Sarah, we really feel for you, and just thanks for calling, and we'll say a prayer for you, okay?
Well, do you?
Okay, thank you, Sarah.
And Sarah can always call our office. We're only just down the road from her. She wants to see
Chattanooga
us.
Allergy Clinic is Dr. Perry's office, and he'd be happy to see you. Just give them a call, Sarah, okay? Thanks. Appreciate it. Okay, next up, well, I think we lost a caller, so I will answer one from here. This question says, my mom is 82 years old, and suddenly at 82, she became allergic to all foods. I've never heard that before, so that's a new one. I've sat in this seat for a long time. I've never, at 82, suddenly allergic to all foods. I would wonder whether it might be something else.
Yeah, I agree with you. Definitely it would be very unlikely for an 82-year-old to all of a sudden start to develop lots of different food allergies. Almost impossible. I would really question the diagnosis of food allergy. And I would talk about each individual food that you're having a problem with to try to figure out if it's an allergy or an intolerance or some other thing going on maybe in the gut system. I don't know what the symptoms they're experiencing are. Are they rashes or GI related? But I think some more investigating needs to be done.
I agree. And something that comes to my mind is a lot of people, all of a sudden they're on a new medicine.
Absolutely.
Or they get a generic medicine that's packaged a little bit different and that they've been taking all along, and they eat it and take it every day. So I don't know. That just a thought out there.
Absolutely.
Now, you brought some inhalers and things like that with us today.
Sure.
A lot of people don't even know what inhalers look like. So let's.
Well, these are mostly nose sprays. There's a couple of nose sprays that just came out. These are a little bit different than some of the typical ones that you see. This is one called Q Nasal. Most of the nose sprays that we have available to us are aqueous. So when you spray them, if it shoots up against the window, you can almost see it dripping down if you sprayed it up against the window. Whereas Q Nasal is a dry powder. So when you spray it, it's more like it's an inhalation or a dry powder. So it won't. One of the most common side effects or complaints we get when we start a patient on a new nose spray is they can feel the taste of it. They can feel it dripping down their throats. And these newer ones that are dry powder or aerosol sprays, you can't do that. So that's one thing that we can use for those patients. So
when would you use that?
I would use this in a patient with allergic rhinitis who has symptoms of allergy, runny nose, sneeze, itch, congestion, who really does not like the side effect of postnasal drainage or the feeling of tasting the nose spray. You can't imagine how many people come back, I can't do that nose spray because I can taste it, makes me sick to my stomach. These types of nose sprays that are just coming out are effective in those patients.
Now, every March, sometimes I get the allergies, and I have a nasal steroid, and I use it, and it clears it right up, and then it just goes away once the allergen goes down. How long is a spray, just for my use? I've had my spray for several years. How long do those last for usually?
It depends on the spray. Usually about a year or two. This one expires in March of 2014. So a year
it says
from
on
now,
the bottle. I guess I should look.
It does. Check out the bottle. This is another new nose spray called Dimista. And it's got two different nose sprays in one. It's got Flonase, which is the oldest nose spray on the market. It's got Flonase in it, and it's also got another medicine called Astelin in it. It combines two classes of nose spray. So the Flonase is called fluticasone. It's a nasal steroid like what you're on. And then the Astelin is a nasal antihistamine. which you can spray. So you can use these separately, or you can combine them into one nose spray. So that's another one we've used a lot of here recently that combines 2 different medicines into one medicine.
Well, those are great. Well, we still have some more time to give Dr. Perry a call. Our number is 855-644-3278. You can join us on Facebook, and you can actually register if you join us or like us for this book, Medicines That Kill, that I wrote. It came out a few months ago. You can ask our questions. Go to our website, heartwiseministries.org. You can visit us there, and you can, Dr. Perry's program will be rebroadcast on our website if you want to catch it again, if you missed some of the good information. Because I found if one person has that question, lots of people have that question. Virginia, we're going to come back to you after the break, so don't go away. Stay with us. We're going to be talking to Virginia, answering her question when we come right back.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We have just got a few minutes left in our program today. It's gone by real fast, hasn't it, Dr. Perry?
Flown by.
So we're going to go right to Virginia. Virginia, you're on with Lee Perry. Go ahead.
Okay, what I have, are you hearing me?
Yes, we hear you, Virginia.
Okay, all right. On my left foot, I have very, very thick toenails. And they're ugly but not painful, and I have to be very careful in cutting them.
Right.
My right foot is just perfect.
Yeah, it sounds like you might have a fungal infection of the toenail. Yeah, the hard part about treating toenails like that, if there's a fungus inside the nail bed, it's really hard to treat with anything topical. So you have to go to your primary doctor, and they can prescribe a medicine by mouth that can help treat it.
Internal.
Yeah, you have to treat it with an oral antifungal like Lamisil. Something like that would work well for that.
And then I had a foot doctor on not too long ago, Virginia, and she says it's very important that you put things in your shoes to keep the fungus out of the shoes. Otherwise, the fungus comes right back.
Right.
So they have special devices that they put in the shoes that kills the fungus in the shoes, so you don't keep getting the fungus back on your toenails.
Oh. Well, in the summertime and spring, and I don't wear, everything's open with my feet, but in the wintertime,
Yeah. But that's what that's what we do. Go see your doctor and see if you need something to treat a fungal infection in your toenails.
Okay, but I was so afraid to take an internal medication because of, your book says it, medication kills. But
everything's about risk and benefits, and your doctor will talk to you about it. And this medicine's just for a short period of time, and they'll usually check your liver to make sure it's safe to do it. Then once the infection's gone, you're off the medicine. But then you have to do things to keep the fungus from coming back.
Yeah.
That's probably the most important thing.
Thank you so much.
You're welcome, Virginia.
You're welcome.
Okay, Ella Morris from Indiana, you're on with Dr. Lee Perry. Go ahead, Ella.
Okay.
Go ahead, Ella.
Dr. Perry?
Yes,
ma'am.
I wanted...
We're listening. Turn down the TV, Ella.
Doctor, I would like to know, are the pen dispensers good for asthmatics?
Are the what good for asthmatics?
The pen dispensers that you were saying you could shoot yourself and take your injection in your leg.
EpiPens.
Oh, good. Epinephrine is not something I usually prescribe for asthma. Back in the olden days, epinephrine was used sometimes to treat asthma, but it's not really the ideal treatment for asthma. For asthma, we start with one of two medicines usually. The most essential one is to have a short-acting bronchodilator like albuterol in the form of an inhaler that you use as needed. And then if your asthma is severe enough, we'll put you on a daily maintenance medicine that usually contains a small dose of steroid that you inhale into your lungs. But epinephrine for asthma probably wouldn't be the best choice.
Okay, well, thank you for your question, Ella. Appreciate it, okay? Hope you're feeling well tonight. Okay, well, we're sort of all out of time here, Dr. Perry. It has flown by, and we're going to have you back again in about 5 or 6 months after we get more questions. If you'd like to go to our website, that's heartwiseministries.org. You can join us on Facebook, and if you still have time to register for the book, Medicines That Kill. If you didn't have your question to answer, join us at another time. heartwiseministries.org is our website, and we want to thank you, Dr. Perry, for joining us, spending your time talking about something you've done all day already. There's a lot of people that couldn't get to the doctor, and they've learned a lot today. Okay.
Very good.
We want you to join us each week on heartwiseministries.org. We're here to serve you, to help you have better health. Thanks for joining us.